NEAPACOH basically is an organization that brings health committees of Africa together. Anybody who is involved in affording well-being and health of citizens must be mindful of the fact that health has no borders, and it's important to interface with others in the region who are involved precisely in similar work. Our ability to hold government to account is being enhanced by our participation here. We also are the ones that approve budgets. So the executive will come with the budgets. If we say no, it won't go. So if we say yes, it will work. But in so saying yes, we must have the right tools to analyze these budgets, to be able to see where the allocation should go, and that information we get it through forums such as this one. So it has been very useful in that respect: legislation, budget, and also accountability and advocacy, because as members of parliament we speak for our people, we advocate for them. So when we speak, somebody is likely going to hear our cry.
2-3 years back, we started talking about national health insurance. And we knew from countries like Ghana that they had made a lot of progress as far as NHIF is concerned. We were able to run a lot about from the Southern African countries. And what that meant for us when we were doing our commitments, I think in 2022, was to include things like universal health coverage as one of the things that we wanted to focus on. This position for me is where we're getting countries comparing each other, being able to see, did we meet our commitments? What is it that country A or country B is doing, and what is it that we can learn from them? So as they come together as peers, as parliamentarians, they're able to compare each other. And that gives them that motivation to be able to follow through on the commitments that they have made. I know for sure one of the things that NEAPACOH has done well is not only just having this regional forum, but also coming in country to be able to follow up on the commitments that our country has made. So that is progress for us.
In the Gambia, we already have a Health Insurance Act, which we believe it was a commitment that we made during our NEAPACOH meetings, and now we have seen it coming to reality. Learning from other countries increasing their health budget have also triggered and also made us to go back to our country and make sure that our health budget increase, and this has impacted in terms of achieving our universal healthcare coverage status. As a country, we are really doing well, especially when it comes to primary healthcare, because we believe it is very important to make sure that you put all the required resources in place so that you will be able to have a very healthy country, so that you can develop as a country.
In those days, we were depending on the donors to build health facilities for the Gambia. And now we have looked inward. 5 new health facilities have been built. And that's from GLF, that's the Gambia Local Fund. Not only that, hospital has been renovated and refurbished with the state-of-art health equipment. Now specialists also have been trained in the Gambia to make sure that we stand in our health sector. And that was through the advocacy and the engagement also we acquired from the NEAPACOH. We use those strategies to convince members to support the committee and to allocate more funds for the sector.
With this collaboration and interactions we are having when we meet as the NEAPACOH, of course we share a lot, and it teaches us to improve on our domestic financing so that we can handle some of those issues concerning the health of our communities. African countries have to make sure they learn to cater for their health systems. We shouldn't depend on donors all the time. So we have to push for the funds, we have to legislate and support the commitments we make here, and make the follow-up, of course, from different ministries, especially Ministry of Health, so that we realize the health system which we need in the country.
And it's high time right now that Africa moves as a bloc. There are a number of lessons. Whenever you come for such engagements, you'll hear what your counterparts in SADC are doing, best practices in West Africa, in East Africa, and so forth. So I think for me it's a very important opportunity, and I would really want us to grow the numbers. We need our colleagues from the Arab North to come in, because when you look at things like epidemics, pandemics, an epidemic in Uganda can easily become a pandemic, because somebody flies out to Zambia, to South Africa, somebody is in the plane from Uganda, he's in Tanzania, he's in Ethiopia. So we can no longer look at our healthcare systems in silos. We need to move as a regional bloc. And of course, you can also broaden the same discussion to immunization and so forth.
The presence of NEAPACOH since 2008, many years, it's now bringing a lot of results. If you can see how much we are scrutinizing the issues of health in the Parliament from the ministers, there's more robust debates around the rationale for the budget, there's more robust debates around amending the laws, there's more robust debate about what other laws are needed. Before, we were just waiting for the ministries, the government to bring the bills to the Parliament. But now we are pushed to say that if you want to implement this, where is the policy? And then if we get the policy, we said, now, can you now develop and establish a bill to come to the Parliament so that what we are doing is within the legal framework of the country. So that has changed a lot into how we look at things. The scientific part of it, which is one of the things that you get from NEAPACOH. You get the experts who are presenting improvement on the diagnosis, improvement in the way we do the management of the patients, improvement in terms of the actual service delivery, in terms of the health services which are offered to the people. Those things have really enriched our experience. So we can say it has been greatly beneficial to be part of NEAPACOH.